Hello, everybody. Today I wanted to talk to you about dental care for you and baby. Teeth, healthy pregnancy. Naturally, we don't always first connect our dental health as an important factor towards a healthy pregnancy. Did you know that pregnant women with untreated gum infections are 7 times more likely of delivering a preterm baby, deliver a baby with low birth weight, or have preeclampsia, so pregnancy hypertension, high blood pressure? Your hormones can change during pregnancy, and this can affect your gums. They may feel more sensitive, they may bleed easier. Anytime between the 3rd and the 9th month of pregnancy, you may experience pregnancy gingivitis. Within your first trimester, it is good to try to schedule a checkup with your dentist. Your baby's teeth start forming during the first 3 months of your pregnancy. The calcium needed to make your baby's teeth comes from what you eat, so not from your own teeth. If you do not take in enough calcium to meet your needs, your baby will draw from the calcium of your bones. Eating enough calcium containing foods, and if necessary, taking a calcium supplement will ensure both you and your baby will have enough calcium without putting your bones at risk. Vitamin D is also important. So when we are taking a look at calcium-enriched foods, we see it a lot in our dairy. So our milk, yogurt, cheese, and if you take a look into vegetables that actually give you quite a bit of calcium too, I always think about broccoli and I believe kale are really top ones that give you a lot of calcium. So morning sickness, we all know that this is a very prominent part of pregnancy. So vomiting because of morning sickness leaves acid in your mouth and it may weaken the protective layer of your teeth. Acid left on the teeth can damage your teeth and can cause tooth decay. Make sure to rinse your mouth with water or fluoride mouthwash. After rinsing your mouth, wait for about 20 to 30 minutes before brushing your teeth. We will talk a little bit about care for babies. Cleaning your baby's gums right at birth. It is recommended that you wipe them about twice a day with a damp washcloth or a finger toothbrush to remove any milk or formula residue. So an example would be in the top right corner there is one of those finger brushes. Developing a routine makes it easier as they will get used to you working in their mouth. Brushing baby's teeth twice a day as soon as the first tooth appears, especially before bed. So if you don't get rid of that bacteria and the sugars that cause cavities, they'll have all night to do their dirty work. Plus, when your child is asleep, they actually do not produce enough or as much saliva to help keep the mouth clean. So children under 3 years, they should have their teeth brushed by an adult. At this age, they can use toothpaste with fluoride, but it's determined by the level of risk. Consult a health professional to determine whether a child up to 3 years of age is at risk of developing tooth decay. If a child is at risk, a minimum amount, so about the size of a portion of a grain of rice of the fluoride toothpaste should be used. If a child is not considered to be a risk, the teeth should be brushed by an adult using a toothbrush just moistened by only water. Children between 3 to 6 years of age should still be assisted by an adult in brushing their teeth. Only a small amount, so a portion size of a pea of the fluoridyl toothpaste should be used. So if you take a look at the bottom left-hand corner, I got an example from the Canadian Dental Association about that size of the grain of rice entropy. I love that example. Children under 4, they tend to swallow almost half of the toothpaste that they use. So swallowing too much of the toothpaste can lead to permanently discoloring adult teeth called fluorosis. You want to teach your children to spit out the excess toothpaste. Um, Then place the toothpaste in a safe place, of course, because as we know, I mean, toothpaste is good to them, right? So it's good to keep the toothpaste out of reach so that children don't need it. Let's talk about getting into some healthy habits. It's normal for babies to suck because it helps them relax. But by the time that your child is 2 to 3 years of age, they have less need to suck. It's best to get your child to stop sucking before the permanent teeth come in. So if a child keeps a soother or if they suck their thumb after the permanent teeth have come in, it can cause problems. So with how the jaw and the teeth grow, top teeth can slant out, bottom teeth can slant in, and they can get a misaligned jaw or a narrowed roof of the mouth. Avoid sipping from a bottle or a sippy cup. It can cause cavities and malformation of the mouth and teeth. To avoid injuries to the mouth and teeth, don't let your child walk around with a bottle or a sippy cup. If they were to fall, it can actually cause trauma and damage to even their adult teeth. Let's talk about moving. The first one would be to breastfeed. So just adding another awesome thing to the list of why we should breastfeed. But we want to make sure that we provide breastfed babies vitamin D just to help strong. Of course, you want to brush babies' teeth. We want to make sure that remind you guys that to lift the lips. So you want to check for signs of tooth decay. We want to check it as often as about once per week. No bottle in bed. Try to avoid propping up your baby's bottle like with a blanket. That's bad for the teeth. Of course, serving them healthy food and drinks will make a big difference to their teeth. It's good to give water in between meals. Avoid sweet drinks like juice or pop. Try to wean baby from a bottle if they're using a bottle in between 12 and 14 months and start making that transition into a regular cup. And using teething rings that are properly recommended instead of your biscuits. So teething biscuits is a pretty popular thing, but you have to keep in mind that that's still keeping food around the teeth and bringing sugar around the teeth as well. Just something that I wanted to add when we're looking at giving water in between meals, you do need to be mindful of the age that you're giving babe water. So you can't, it's best not to give babe water too early, more towards 12 months. It's always good to ask your doctor or healthcare professional when would be a good time to start giving babe water because too early is not good for them and it's not good for their tummy. So the challenges of teething, we sure know about this one, don't we? Teething is difficult. It's a difficult thing to determine as a parent, right? Commonly, teeth, they tend to move up and down and they can become unpredictable as to when they will finally erupt. So what that means is when the tooth breaks through the gum. This can obviously cause lots of pain and discomfort for our babes. Some symptoms of teething may include a mild fever, increase of drooling, you could even see a runny nose from them, a decrease of appetite if they are starting solids. So you won't necessarily see, you don't want to see a decrease in them drinking their milk. That would be probably from something else because it is easier for them to comfort from drinking their milk and easier to drink. When you see a decrease of appetite in the solids, it's from them moving their jaw and starting to learn how to eat the solids, and that will irritate the mouth and the gums and any teeth that are coming in. Of course, we see irritability. and even you can see a face rash when it comes to teething. So it has a lot to do, I think, with the drooling and stuff like that. There are many handy and safe ways to relieve the pain of the teeth coming in for your infant. So one being to lightly rub your baby's gum with a clean fingertip or damp washcloth for 1 or 2 minutes. We want to be cautious when we are giving our baby something like a teething ring. So solid silicone-based teething rings are recommended over the liquid-filled products, because you have to think that with the liquid-filled ones, they tend to leak, and you also can't sterilize them at all as well as you can with a silicone-based one. You could try putting the teething ring in the fridge, but you want to avoid putting it in the freezer. So you can put it in the fridge for a while before you're giving it to baby, but don't put it in the freezer. The ring can become hard and it can actually injure your baby's gum. Another thing that we need to look out for that we don't really think about is that you could actually give them almost like a frostbite, like freeze burn on their gums. They're so young; they're not really there to determine when it's a good time to take away the soother when it's frozen and stuff like that. So um, that's not from the. Be sure to clean the teething ring after each use. It's also good to inspect it regularly for any sort of changes in the texture, tears, or holes. And of course, try cuddling your baby when they seem uncomfortable or if they're in pain. Activities that can distract them are always good. So something even simple as singing to them or reading to them can really help as well. So please note, this is a really good one to listen to. It's very important. The Canadian Dental Association does not recommend the use of those teething tablets or putting teething gel on your child's gums. We have previously actually talked about this in group, and a mom had a really bad experience with like an Oragel or one of those teething gels. They can actually make your baby's throat numb, which can cause lots of trouble, right? People with swallowing, they can determine that they can't feel it, it's numb. So it's best to avoid any of those over-the-counter products for teething. I know it's tempting because teething is a really difficult thing to go through with your child. To see them in pain, they're very irritable, but it's really good to just avoid those products. So the more you know. First visit is free. Isn't that awesome? So under the 3 years of age, your first visit to the dentist for your babe is free. The Canadian Dental Association does recommend that your child sees a dentist within the 6 months of the eruption of the first tooth, or for sure by the first year of age. And that's at the latest, which I was, really surprising to hear, but the earlier the better, of course. And the goal is to visit the dentist before you're seeing any problem. Thank you very much, guys, for listening. Of course, always take a look down in the description because there's always further links or different things that connect with the dental care for your babe and for you during pregnancy. And we hope to talk to you soon.